Hi, my name is Leah Fischer. I am a Registered Provisional Psychologist, and I am going to talk about perinatal mood disorders today. Perinatal mood disorders actually was more known for postpartum depression before it has now kind of encompassed more definition as the years have gone on. There are 7 different types that fall under the category of a perinatal mood disorder. It is not the baby blues. It is more of a mental illness that is debilitating. The language around perinatal mood disorders has developed and gone through its own journey. It started not talking about anything to going to a point where we talked about depression. So it was postnatal depression. That was what was focused on. Now we're starting to encompass more of what the true experience is of many women. It is specifically 7 disorders that they are depression, anxiety, obsessive compulsive disorders, postpartum PTSD, bipolar disorders, and postpartum psychosis. Perinatal mood disorders affect 1 in 7 women and 1 in 10 men. People of every age, culture, ethnicity can experience it. It's very similar across the world, and it's actually very common. Perinatal mood disorders have been a hush topic for a very long time. Only recently, maybe the beginning of the century in 2000s, have really society started to talk about them and acknowledge them. In 2006 in Saskatchewan, there was a group of women that came together after they were in a group and wrote a book called The Smiling Mask. It really affected our region in knowing that there were people out there starting to talk about it. And following that was a video, or another book, about Brooke Shields' experience with postpartum depression, which rocked the world. Postpartum depression, I consider it kind of a forgotten burden with women. We're expected to feel like we know what we're doing and how to do it and deal with all the physical issues that come with the new role. But the fact is, it's hard. If you are in a place where you're a different culture, if you're in a new place where your family isn't, in our transient culture, we might not be with our families. You're very isolated, and adding COVID on top of all of that has made it even harder for women. There's many things that we can do to help women. It's not something that they have to deal with alone, and with some acknowledgement and support, it's very curable and can lead to a very happy, productive family. Mental health falls into one of the chronic illnesses in Canada. It's actually one of the top 5 chronic illnesses that affect the population. Mental illness has a huge impact on the financial burden of the medical community, and the more that we can address supports early on, the less of an impact it will make on the financial structure as well as the burden of the family. In Canada, there is 385,000 births per year. In Alberta, there's 55,000. The stat of 1 in 7 women translates to about almost 8,000 women in Alberta every year suffering with the perinatal mood disorder. The most sad stat that I came across is that 85% of women would rather talk about a physical illness than a mood disorder illness. They would rather keep it to themselves and try and deal with it on their own, which is, if you've ever had any type of depression or anxiety, or OCD is next to impossible to do on your own. So that 85% of women choose not to get help just breaks my heart, and I think we need to make it okay to talk about it more often. Symptoms of disorders, they range as different as the mums could be. It could be being very anxious, worried about everything, never sitting down, never sleeping. They could be hyper sensitive to looks and what's going on, what to dress their baby themselves. They could be sensitive to depressive symptoms. Maybe they're not getting out of bed. There's no interest in the baby or even taking care of themselves. They could have OCD type behaviors, having to go over something multiple times to allay their anxiety. They could have physical symptoms that don't allow them to sleep, like insomnia. They could be dizzy, have heart palpitations. They might not want to eat. They might eat too much. They could have scary thoughts, intrusive thoughts of harming the baby. They could want things done a certain way for the baby and not be flexible with anybody caring for the baby as well. They could also be worried about germs and illness around the baby. And to some extent, we expect a little bit of this from moms, but when it crosses into an extreme behavior or unreasonableness, then we start to worry about maybe it affecting them. Moms will feel depressed, lonely. They might feel nothing at all. They could feel absolutely void. They could also have focus issues, unable to focus on a task, unable to make a decision. Foggy brain, just things aren't clear to them about how to keep moving. And keeping in mind, all of these things are happening within their brain that's scattered and not making sense. And all the while they could be smiling and saying, everything's great, everything's fine, the baby's fine, I'm happy. It's the biggest disservice to moms, because if they are happy, then that means nothing's wrong. But unfortunately, it also doesn't tell the people around them that they need help. Risk factors for perinatal mental health disorders can be family history of mental health disorders. It could be the mother's own history of mental health. It could be traumatic pregnancy, delivery. It could be a loss of baby. It could be baby in the NICU. It could be relationship status with their partner. They could have financial stress. They could maybe have more barriers, like being single or a teen mom. There's many different influences that can come together and even add up that make moms more at risk for the disorder to affect them. Additional perinatal struggles might not be considered mental health disorders, but if you're worrying about should I have a baby at all, it creates a lot of stress and anxiety. Maybe you are infertile and you and your husband are struggling with those issues. Those also will cause symptoms of depression or anxiety as well. If you have infant loss, miscarriage, there is a need for people to have that aftercare for those issues that aren't talked about. And reaching out to others that have been through it is one of the best ways to be able to get through it. They also can have PTSD from birthing and possible reasons that have led to pregnancy terminations. We want them to feel, moms to be supported in whatever struggle they're going through in pregnancy and after they've had the baby. Not to forget dads in the family structure of having a baby. They will be affected by the mood disorders as well. They can have them themselves. They also will be experiencing the issues right alongside moms with infertility, infant loss, miscarriages. Some have a harder time if they have not been exposed to the actual baby. That makes it more real to them. So miscarriages are a little bit harder for dads, but they are experiencing and wanting to support the partner as much as they can. It's a very helpless feeling because you can't fix this. You can't will yourself to be better. You can't will them to be better. You can't just be positive. You can't just take a walk. It's a mental illness. You need medication and you need counseling and support. Most of the mood disorders can be supported without an emergency state. You can help them slowly get help, support them to be more successful in a day-to-day skill. The one caveat to this is postpartum psychosis. That is a medical emergency that you have to get moms to the hospital for. They risk harming themselves and they risk harming the baby, and their thoughts are not clear enough to live day-to-day and make positive decisions for themselves. As well, if you hear, my family's better off without me, I don't think I can do this, I don't want to be a mom, some of those issues that hint towards suicidal behavior, you want to ask about and ask them directly if they are considering killing themselves or if they need help. We want them to have a voice, and most of the time they need to be asked. And they need to feel like the people around them are comfortable to do that, for them to be able to talk about it. From my perspective, I feel like we need a social shift. We need a social shift that says, yes, we can be individuals in this society and be accomplished and do hard things and go to school, have jobs, but when it comes to mothering, we need to allow for them to be vulnerable and have mental struggles when there is a biological process going on that is a complete upheaval of their system. The hormones in their body, they have their own path, and we need to just be on guard for them so that they can traverse the journey with support. Doing it on your own it's hard, like any journey. So I would like for our society to even look beyond our culture and look to others that do supporting moms so well. For example, the Chinese culture has a practice called mothering the mother. And in that practice, the mom is a patient as well as the child. They are taken care of as gently as a newborn is. They are given space in the home to rest and recover, and the baby is brought to them to feed, to be together, and taken away when she needs to rest or have a bath. It's that she is not responsible for everything in their life, plus the baby, plus herself. It's just healing. That's it. And it's not forever. It's a 40-day commitment by family and supports to say, right now, this mom is the most important person in our unit, and we need to take care of her. So mothering the mother is the social shift I'd love for us to start focusing on. This shift is actually supported with research in looking at the protective factors that will help with perinatal mood disorders. Protective factors such as supports, such as having a distinct postpartum period that is given to the moms to heal. Yes, they might have time off, but it doesn't mean that there's someone there to support them through it. Social acceptance or acknowledgement of their new role, and that it can be hard, and that it's talked about. The biggest thing that women say after they have babies is, why didn't anybody tell me? Why didn't anybody talk about it? You know, it is hard, and you don't want to scare moms, but sometimes they want to know, you know, the details, the experience of it. How you deliver it is probably the biggest gift you can give to a new mom or a mom that is pregnant. And just saying that it could be any different type of experience, but share yours with your own struggles and maybe your own successes. If you are a family and you are supporting mom, there are certain things you can talk about with mom to ask what would benefit her best. If she is dealing with a mood disorder, it will cloud her problem-solving abilities. The most simple way you can ask maybe closed-ended questions, the easier it'll be for her to make some decisions. So some examples are, Can I clean your bathroom? Can I take the baby so you can have a shower? What would help you most right now? Might allow for her to say, I need to talk, instead of having something done. If you just provide the opportunity for her to say whatever is on her mind and give her permission to talk about hard stuff like suicidal thoughts or intrusive thoughts like, there's knives in the kitchen and every time I walk by them, I'm scared. It's such a relief for them to be able to talk about it and not think they're crazy and not think that if they talk about it to somebody, that child services is going to come and take their baby. It's one of the biggest fears of moms is that sharing this will cause further problems. Very clear questions that she is able to say yes or no to will allow for her to have more support immediately without seeking it out on her own. And lastly, providing reassurance is a gift you can give mom that just helps her get to the next chore, the next day. You get over one more struggle one more struggle that she feels like she can't deal with. So saying, you're doing a good job. You are a good mom. This is hard. I see how hard it is. This isn't going to last forever. Sorry that you have to go through this. We'll get through this together, and I am here for you. Whatever you need is sometimes the best words to hear as a mom who's struggling, and that she doesn't have to seek it out. That's one more thing to do that she can't do. So just be available for her to depend on you. Deciding when to get help is a personal choice of moms. Generally, though, if you are having thoughts or feelings that are interfering with your day-to-day life and not allowing you to maintain the way you like to live, you can talk to anybody about those things just once. If it doesn't fit or it's not the right time, there's no rule in saying that you have to go back, you have to continue. You can't start or stop. You know yourself best about what your normal self is like and when you aren't feeling normal. That's your definition. Most women say, I just want to get back to my normal self. When you feel like you're having thoughts that aren't regular for you to have, or they're scary, if you feel like you can't get out of bed, you have no energy, maybe you are not able to settle down or sleep even though you have the opportunity to sleep. All of those are regular patterns, are red flags for you to just reach out and ask for advice in how you should proceed. Treatment options. The mom has to be maybe given some options of what she feels most comfortable doing in the initial stages of trying to deal with her mental health. It might be a slow offering of just going for a walk. It might be directing her to her family doctor to talk about it. It usually is most successful combined with medication and counseling. Maybe a counselor that she feels comfortable with, talking to them. Also can be just a offer to take a nap. You need 6 hours, 5 to 6 hours of uninterrupted sleep in a night to be able to get through a REM cycle, which in turn allows you to be able to function with basic needs and responsibilities the next day. If there is any way she can get that in the night, uninterrupted, 5 to 6 hours, that would be a gift for her. Treatment can also be her diet, fluids. It could be relaxation techniques, meditation, mindfulness, something she listens to, and can be bright light therapy even to increase moods. Any of the options that she can try should be discussed with her so that she can start out doing what's most comfortable for her first. I want to mention Postpartum Support International. You can see that their name reflects the early years of us discussing the mood disorders. We refer to them now just as PSI. They began in the late 1990s and have since grown to a international support for women so that women don't have to be dependent on what's offered in their community. PSI offers a multitude of groups specific for different experiences of women, be it the loss of a baby or miscarriage or the PTSD in birth. I think they're up to like 30 types of groups that women can link into, which has been another benefit of technology. The facilitators can be from all over the world. They have different languages that can support women, and it is all accessible from their one website and can describe to you what best fits for you. Additionally, they have what they call not a hotline but a warm line, a place where moms can call 24 hours and they'll always get somebody on the other line. It's a 1-800 number, it's free, and they don't have to go anywhere outside of their home to be supported. The last thing that PSI offers that is such a benefit to moms is a direct line for medical personnel that help them, specifically psychiatrists. So psychiatrists that are in their community can call this line to be able to consult with another psychiatrist who specializes in perinatal mood disorders and be able to be guided in best support for moms based on their experience. In the region, you can access your doctor, you can talk to your public health nurse that you might come into contact with after you have the baby. You can go to the actual public health clinic. I know we have a nonprofit agency that has a Best Babies program. If you also want to look for general support with clothing, you can go to the Nurture Agency in downtown Medicine Hat. And if you're in crisis and you need somebody, you can also call the regular emergency lines like HealthLink or 911. If we can do a very thorough screen of moms before they have the baby, it's unfortunate, but the physical stress alone of just being pregnant and going through labor with the hormones and the chemicals changing can be enough. It could be that one ingredient that can make the difference. But the more you stack onto it, socioeconomic things, relationship factors with your partner, what you're dealing with in your own life, do I have a place to live? Do I have enough food? Basic things that compound the stress on a mom can make it happen. And in the same breath, you can have absolutely resilient moms who can go through many stressors and not have a problem. And that's why we need to do the screening. We don't know, and we hide it very well. It's a mask because we're supposed to be happy and we're supposed to love these babies and be enjoying them and have that picturesque family. But the truth is 1 in 7 can't do that because they are struggling. We need to be a society that is knowledgeable of that, about that, and be able to be there for whatever the outcome is, be it happy, be it no risk, and be it a problem. We won't know until we actually ask or do the screen. I think the takeaway from this is that this is not uncommon. It's so common. Because it is common, it will be easier to help. The research is very limited in this. We need much more research to gauge our efforts and to make sure that we're doing things efficiently with our time with moms. We need them to know that moms are not to blame. They didn't cause it. And with help, they can get better. The family can be happy. And it can be a positive future.